Okay, next point on our Big 15 is gallbladder 34, Chinese name Yang Quan, English interpretation Yang Mound Spring. Um, the point and the terminology used there is supposed to be an analogy that if you are stiff, if you are tight, if your tendons are bound together, if you stimulate this point, it's like a spring coming out of the earth. Very good point for the liver and the knee, and also the hip. It's one of the common peripheral points I do with hip pain. It's not a point I use absolutely every day, but it's very good for lateral knee pain, bursitis, hip pain, that sort of thing. Um, it's also a very important point because gallbladder is paired with liver to treat the gallbladder and liver if there's any inflammation or pathology associated with those organs. Uh, One of the things with gallbladder 34 is it's highly recommended for any tendon issue, not just knee pain, but tendon itself. And in my practice, I do a lot of mirroring. So if you have lateral knee, if you, for instance, had tennis elbow, it would be a point I'd be looking for to use, as it would help also with tennis elbow on the opposite side. Uh, it's a significant point for sciatica, but I think it's better for L4-5 disc rather than L5-S1. Also good for stress and any sort of emotional well-being. One of the important sort of modern physiological links is that it can actually stimulate dopamine, which I find really interesting. That with any sort of Parkinsonian type tremors, it can be beneficial to stimulate gallbladder 34 as well. Common uh, point combinations are 34 and stomach 36, very good for just tonifying chi, strengthen legs, and if someone's sick, recovery after that. Liver 3, obviously, if to harmonize liver chi, easing anger, frustration, and musculoskeletal tension in general. Bladder 60 for general stiffness, spine mobility, and athletic soreness. And large intestine 11 for inflammation or heat in joints, and spleen 6 for menstrual cramping or those sorts of issues. I think that sums up gallbladder 34. It's not an everyday point, it's not a rare point, it's somewhere in between. Hope that clears it all up for you with gallbladder 34, and I'll see you on the next point.